The topic chosen for the BSM assignment is skin contact impedance affecting biosignal quality, followed by three members, that is myself, Shreyas Nayak, and Vishrut Kavle and Rohit Raju. So basically, skin contact impedance is nothing but the electrical impedance between the skin and the electrode. This is particularly true in the case of electrical impedance tomography, that is EIT, which uses a large number of skin contact electrodes and is very sensitive to noise. There is an increasing need in biomedical engineering to consider new electrode technologies. Movement artifacts, baseline variations, and contact impedance prevent the recording of the ECG during resuscitation and constrain implanted devices for functional electric stimulation of muscles, etc. So the challenges faced by this method or technique is patient biopotentials are usually measured with conventional disposable silver chloride electrodes. These electrodes provide excellent signal quality but are irritating for long-term use. To overcome these difficulties, researchers and caregivers seek alternative electrodes that would be acceptable in clinical and research environments. The problems faced by this technique is as follows. Ion currents have to be converted into electron currents with the electrode as transducer. The skin impairs the transfer from ions in the tissue to the electrons in the electrode. The capacitances of this layer is poorly defined and unstable. The electrical transducer comprises the resistance of the electrolytic gel and the double layer at the electrode electrolyte interface, as well as half potentials at both electrolyte interfaces. So the solutions are as follows. Silver chloride gel electrode, that is weakly polarized, introduces low ohmic impedances, limited shelf life, and not reusable. Secondly, dry electrode, which is partially polarized, introduces a parallel circuit of ohmic and capacitive impedances. And lastly, capacitor electrode, perfectly polarized, introduces a capacitor foam electrodes. And from this diagram, you can see that it's basically an electrical model for electrode to skin interface. It has two methods, that is a gel electrode and a dry electrode. And for this graph, it is so this graph represents skin impedance to the against frequency response. And lastly, for the conclusion, for clinical applications, silver chloride gel electrodes are convenient in terms of robustness, cost, and ability to adhere to the skin well. The signal provided is excellent for monitoring and diagnostic purposes. In fact, dry electrodes are not used in clinical applications. However, dry electrodes may be suitable for situations where the patients have sensitive, damaged, or burned skin for neonatal patients or where ambulatory monitoring is desired. Uh, Thank you.